Newly released access to information documents expose internal emails from disgraced former Chief Public Health Officer Theresa Tam tied to Canada's disastrous vaccine injury support program called VISP. Let's dig in. Launched in June of 2021 during the COVID-19 vaccine rollout, VISP was framed as support for rare but serious vaccine injuries. But from the onset, internal emails show chaos, and this batch here proves it. Days before launch, the focus wasn't on operational readiness, it was messaging. Media lines, news releases, and Tam's tweet were rushed for approval. Meanwhile, the third-party administrator RCGT, now Auxero, a consultancy firm with no prior medical experience, was described as ready to accept claims. Except the lie detector test determined that was a lie. Within 6 months, initial funding allocations for this program were capped. The government had dramatically underestimated demand. My previous investigation found it took nearly 3 years just to determine how to properly administer the 5-year program. So much for timely support. The financials tell it all. The original $75 million budget ballooned to $111.4 million by 2024. In 2021 and 2022, $9.38 million was allocated, but only $70,000 went to the injured claimants, while more than $5 million went to Auxero for administration. That's a massive difference. By late 2024, $65.2 million had gone to Auxero, dwarfing the $16.9 million paid out to claimants. Administrative costs were roughly triple the amount paid to the injured. All the while, claims surged. By December of 2024, more than 3,400 claims and appeals had been received, but fewer than half were processed. As of December 2025, 3,557 claims have been submitted, a fraction. Just 252 have so far been approved. Media outlets were pressing PHAC about missing acknowledgements, long delays, and budget discrepancies. Internal emails show that PHAC was even coordinating with the Privy Council office on messaging. We will also FYI PCO. Andre Gagnon of Media Communications at PHAC wrote in 2021 when asking for updated media language, confirming some language directly with RCGT. This is unsurprising given what we know about how these top government officials and the memo that they put out to reinforce the safe and effective narrative, even as complaints and injuries mounted. The documents also confirm Canada's National Immunization Strategy called NIS aligns with the WHO's Immunization Agenda 2030, prioritizing uptake and equity. Yet when injuries were reported, PHAC repeatedly deflected responsibility to Auxero, citing it as an independent third-party administrator handling claimant information. As a result, transparency is basically non-existent. This is compounded by the fact that VISP operates under a contribution agreement, not a service contract, meaning fewer procurement rules, less disclosure, less visibility into decision-making. 4 companies bid on the program, but PHAC redacted their financial proposals, once again citing third-party confidentiality. As part of previously approved media responses, February 2025 emails show that VISP's review committee has 6 members named, including Health Canada's Theresa Bagnall, who, interestingly enough, was also responsible for implementing the Canadian thalidomide survivors support program. Remember nearly 2 years ago when I asked the question, will VISP last decades like the thalidomide compensation? It certainly seems that that's the trajectory this program is on. The other members of the review committee included Crystal Garrett-Baird, a director general from Veteran Affairs Canada at the time, who provided expertise in benefits and support service delivery. Melissa Tutloff, a senior policy analyst in the Privacy Management Division at the Public Health Agency of Canada at the time, provided expertise in privacy and information management. Chris Archibald, a public health physician within PHAC's Office of the Deputy Chief Public Health Officer, who supported the coordinated response to COVID-19 pandemic and was selected to provide medical expertise in public health. An unnamed official from the Canadian Blood Services provided not-for-profit representation with expertise to claims management system, and a provincial representative from the New Brunswick Department of Health provided expertise in health support systems. And the rest of the review committee members, well, they're unable to disclose the individual names of anyone who isn't a member of the federal public service, again, because of third-party confidentiality and the nature of this contribution agreement. Now, in 2026, Auxerro's agreement is ending, and PHAC will take over management of VISP in April, despite internal acknowledgement that I uncovered in a previous investigation that this creates at least the perception of a conflict of interest. So here we are now, a program launched with promises of compassion and timely support, defined by instead ballooning costs, bureaucratic delays, and limited transparency. With PHAC taking over this year, will things improve? After all, it's the same institution that designed and promoted the National Immunization Strategy, now set to manage the consequences. Expecting independent, timely, and transparent accountability from the architects of the system. Don't hold your breath. For Rebel News, I'm Tamara Ugolini. If you'd like to find out more about this topic and support this work, you can do so at nomoreshots.ca. That's nomoreshots.ca.